All right, so the doctor has ordered for patient in room 1 IV needed, rehydration and antibiotic therapy. So I would go to the patient's room, wash my hands, introduce myself. I would check the patient identifiers 2 ways. I would explain to the patient what I was doing. I was going to make sure the patient is in a comfortable position and that they were in a snap gown. I would then check my 6 rights and I would go to the med room and verify the MAR and patient order, doctor order, and I would then prepare my IV. And now that I have left my patient's room, I'm going to go back to the med room and I'm going to start to prepare my IV. And I'm going to get the 0.9% NS, and the doctor has ordered 1,000 milliliters to infuse over 6 hours. So I'm going to perform my 6 rights: right patient, right med, right dose, right route, right time, and then I'm going to document. And so I'm going to go ahead and get this started. And I will open up the bag. I'm going to, this whole time, be checking the expiration date. It's not expired, and making sure that there's no floating, no discoloration, no leakage, and it looks good. So this is going to be what I'll use. And I have an IV pull over to the side. So I'm now going to open my continuum. And my continuum is, I have a drop rate of 10. So that means I'm going to be running my IV at 167 milliliters per hour. And that's about 28 drops per minute. And so when I set my IV here in the med room, I'm going to test it for around 7 drops per 15 seconds. Alright, so then I'm going to make sure that all of my locks are locked. And now that they're all locked, I'm going to spike my bag. And I want to make sure that I don't touch the tip to anything. And I don't want to poke through the form. And before I would have taken my cap off of this, I'm going to alcohol the top. And then I'm going to spike my medication, or my IV bag. Okay, and now that I have this spiked and all my locks are locked, I'm going to hang it up, and I'm going to now make sure all the air, or I'm going to fill this up halfway, and then I'm going to make sure that all of my air bubbles are out. So I'm going to drain this. And when I drain it, I want to make sure that I am flipping each port upside down to get all of those bubbles. And I'm going to leave the cap on so I'm not wasting more than I need. And now that I'm tipping all the ports upside down, I'm getting the air bubbles out. And these are just the last few air bubbles going out. All right, and so I'm going to then stop this so I can set my drop rate. All right, so now I'm going to set my drop rate. So I am going to unlock this and then slowly kind of look for 7 drops per 15 seconds, and I'm going to be watching the time. And when I have it going at a rate, I'll start watching. All right, and that is set for 7 drops per 15 seconds, which goes up to 28 drops per minute, which is 167 milliliters per hour. I'm then going to lock this without having to mess with the roller lock. And now I'm going to go start the IV on my patient. I'm going to take this into the room with me. All right. All right, so now that I have my IV spiked and hung, I'm going to start my IV. So I'm going to go to the patient's room. I'm going to introduce myself again. I'm going to check the patient's identity using 2 identifiers. And then I'm going to start or open all my supplies so that those are open and ready after I've washed my hands and then put my gloves on. And so I washed my hands and now I'm going to put my gloves on. And I'm going to start by finding the vein. So I'm going to take my tourniquet and I'm going to place it above. And I'm going to tie it. And once I have it tied, I'm going to palpate and find the vein that I'm going to use. And this looks like a pretty good vein, so I'm going to use this vein. I'm going to release, and then I'm going to open my supplies and have them open, but keep them sterile. So I'll open up my gauze and have that open and ready. I'll open my lock. Okay, so now that's ready and I have all my supplies, I'm going to then lock or tie my patient's band, use my alcohol swab, and I'm going to clean the site. And then once I have it clean, I'm going to take my needle. I'm using a 20 gauge. And I'm going to loosen my catheter so I can easily pull it up. I'm going to hold so now that I found my vein, I'm going to make sure that there's no tattoos where I'm going to insert my vein, and that if there's excessive hair, I'm going to trim it. And then I'm going to make sure I have my bevel side up on my needle, and when I insert this in, I'm going to go at a 30 to 45 degree angle until I get flashback, and then I'm going to go straighten it out. And then I will make sure that I'm not inserting the needle with the catheter when I am inside the vein. So I'm going to hold the vein in place. I'm going to go in at my angle, and once I see flashback, I'm going to enter that in. So now that it's inserted, I'm going to remove my needle while pushing the catheter up, and then I'm going to I lock my needle, I'm holding the vein right above where I inserted it, and then I'm grabbing my lock and I'm luer locking that into place to stop the bleeding. So I'm holding the vein down, and I am then going to release my tourniquet, and then I'm going to slowly push in 5 milliliters of saline solution. And I had already tested it to make sure that it came out okay. And I am inserting 5 mils, and I'm just moving my hand for showing purposes, but I am in the vein. And now that I'm done, I'm going to remove my flesh. Alright, and now I'm going to take my tape and I'm going to secure it using the chevron technique. And I'm going to make sure I don't cover the entry site. And I'm going to go around and place it, and then I'm going to come back with the other side and place that like that. Alright, and then I'm going to take my gauze pad and so then I'm going to take my other piece of tape and I'm going to secure the gauze, and then I'm going to take this and I'm going to place it not covering the lock. Alright, and so then this is already date, timed, initialed, and then labeled with the gauge of the needle that I used. And then I'm going to make sure that I discarded my needle into the locked sharps container and dispose of all my garbage. I'm going to check how the patient did with the procedure. I'm going to remove my gloves, wash my hands, and I'm going to go back to the room and I'm going to document what I did with the time, how the patient took it, and the gauge that I used. All right, and so I'm in the patient's room. I'm going to start the IV, and I'm going to make sure that I alcohol the entry site just to be safe, and I'm going to then take off my cap to my IV, and I'm going to insert that and lock it. And then I'm going to reestablish that I do have the correct flow rate. So I'm going to unlock my I have now unlocked my tubing, and I'm going to reestablish that I have the correct flow, dropping at 7 drops per 15 seconds. Alright, now that I have that established, I'm going to make sure that there's no kinks or anything in the tubing. So now that the IV is set, I am going to go document, and then I'm going to come back and monitor the infusion. I'm going to gather any pertinent data, and I'm going to go chart that if needed. I already have the rate of flow established, so I'll check that. I'm going to make sure that this is the correct solution that I'm infusing. And after that, I'm going to inspect the patency of the tubing, making sure that the tubing and needle are positioned correctly and there's no bleeding. And then I'm going to check for fluid infiltration. If infiltration is not evident but infusion is not flowing, I'm going to actually determine if the needle is dislodged from the vein. I also want to make sure I'm watching for phlebitis, and then I'm going to teach the client to ways that will help maintain the infusion system. And then once again, I'm going to go back and document what I just observed. Also, all the time making sure that I am washing my hands going into each room, and also washing my hands as I leave the room and introduce myself and identifying my patient using 2 forms of method.